Good morning, everybody. It is time for the Orthopedic Minute, and we do have a doctor from DMOS joining us in studio right now. Ian Lynn is here, and we're talking about something that affects a lot of people, Jackie, so you need to pay attention to this.
Well, especially if you're having some knee issues, this might be the root of the cause. Meniscus. Let's talk about that, Dr. Lynn, this morning. And I was asking you, when you say meniscus, where exactly is that in your leg or knee area?
Let's identify it.
Well, this is your knee. This is a typical model of a knee. So you have your thigh bone, your shin bone, and the meniscus is actually the shock absorber pad between them.
So it's the padding here.
Kind of your
Yes.
cushion
Here.
for those two
Cushion.
bones.
That's
Okay.
correct. Now, the meniscus is important because it provides shock absorbency, but it also provides stability. So if you look at the meniscus, you can see that it's kind of cup-shaped.
Yeah, okay, so they keep it where it belongs, yeah.
Right, because if your thigh bone is sitting in there, you can see it sort of forms like a little cup for it.
Okay,
And that's why it's important.
like a ball and socket.
That's correct.
Okay.
But it also might be the root of some other issues, and that's why we're coming to see you.
I know
correct?
there's hundreds of thousands of these arthroscopic surgeries done for meniscus tears nowadays. When we first started out, we used to do them open, where you'd make a big incision and you would just cleave out the entire meniscus.
Really?
We know now that we try to take out as much, as little tear as possible now.
To leave as much in there as you can.
That's correct, because we know the importance of that shock absorbency now.
All right. And what was the result when you were removing all the meniscus before?
Arthritis.
Arthritis.
Yeah,
So-
yeah. So the less you trim, the better.
Okay.
So why would we be coming to see you about our meniscus? What's the most common ailment that you see?
Pain. So when people come into we get referred patients because they have pain, typically in one of the sides of the joint space, the inside or the outside.
Okay.
The inside is the medial, outside is the lateral joint space. So typically people have had some sort of injury where there's a twist and turn and they feel a snap and they have pain, their knee swells up. So, and then they start to feel a little snapping and catching sensations in the joint space.
Getting hung up,
Okay.
yeah.
Yeah, and that can be a meniscus tear.
That's
All
going
right.
to be
And is it
meniscus
because people
tear.
become more active in the past couple of decades?
I think that's probably the main reason. Plus, kids play in so many more sports now than when we used to.
Right.
Yeah.
We're showing you different types of meniscus tears here on the screen right now, Doctor. Kind of explain what we're looking at.
So in the top ones, they're kind of more smaller tears. They can have these little lunar tears. You can have the radial tears, the one in the top middle
Right.
there. And that one is just a kind of a tear that goes straight to the side. And then the bigger tears are the ones like on the bottom where you can see that meniscus is torn and it's flipped. So we call that a bucket handle tear.
Ooh.
Because if you think about a meniscus, if it flips over and now your thigh bones can't straighten out.
Can't seat.
Yeah, it can't
Ouch.
sit down, so that's one.
That's got to be incredibly painful.
Yeah, it can. And we had a wrestler come in the other day, and his knee from just wrestling tore so badly that he cannot extend his knee out past 30 degrees. So he comes in and his knee's all bent.
So how long of a operation, how long of a procedure is this to try to repair these?
Yeah, how are things changed when you
Yeah.
completely opened up the knee and we're digging things out to what happens today?
Well, nowadays we do it with tiny little holes. We do it arthroscopic. So we put a hole in the knee so you can look at it diagnostically, and then we have another hole in the knee that we can just trim out the tear as needed. So we're just trying to ellipse out the tear, try to leave as much as possible. Sometimes we have to take out more than we want to, and that's called a complete meniscectomy, and sometimes we repair them.
Okay, and by repairing them, what do you do when you repair them?
Well, we actually put sutures into the meniscus to try to lock it back into place where it was.
Now, will it heal again? Will it heal back together?
It varies. Now, if you choose your tears wisely, there's a good chance that they heal. The problem with the meniscus is if you look at the anatomy of the meniscus, only the outer 25 to 30% of the meniscus has blood supply. The inner 65, 70% do not have blood supply.
So there's really no way to
Really?
So
get
if you have a
nutrition to it,
tear in the inside, you
Inside.
can't heal it.
Right.
Okay.
But if it's on the periphery, you can heal it if you put sutures in it. Now, some tears can be small, like 5mm tears in the periphery, in the blood supply area. Most of the times you can leave those alone if they're not unstable and they're not causing
Okay.
any problems. So that's why we try to treat some of these conservatively, because who knows, it might heal on their own, right?
Wow,
Okay,
tells you
now-
how precious your knees are. Is there any possibility of getting a replacement, or once it's gone, it's gone?
Yeah, we do have cadaver replacements for people who have had complete meniscectomies. They're difficult to do, and the results are only marginal.
Right.
Okay.
Just trying to get everything
So
seated
it's
where it
more
belongs.
important to keep what you have. Keep what you have.
Okay, now we're talking about the repairing. The repairing one sounds fascinating, and you brought a sample here, and we can show people how you repair these, right?
I was thinking that you should be an orthopedic surgeon.
Okay, we should do this. I've always wanted to have doctor in front of my name.
I had no idea you could learn how to do this in a morning.
That's right. So this is the medial meniscus. This is the lateral meniscus, and again, you see the cup shape of it.
Kind of looks like an ear.
Yeah. Well, I already did meniscus surgery on this side, and you can see these little plastic plugs.
Here we go. There's the plug here.
These plastic plugs come from this little device that we push through and snap it, and then pull it out. Push
It's like
through.
the buttoneer.
It's sort of like that.
And that's fixing a tear that would be in the meniscus.
Yeah, you can imagine if someone had a peripheral tear out here.
Okay. Yep.
So
yep.
we're going to
Okay,
have
so what
you.
do we have to do here?
Okay.
Okay.
I'm going to show you. You have to poke. Go ahead. You
go ahead and
hold
poke it through here?
Poke it through. Now click that button. This button right here.
Okay. Okay, let's get this out of the way here.
Click. Good. Now it deployed it. Now you pull it back.
Okay. So
Just
you're
like
pulling
this.
back and it has.
And then you push through it again.
Oh, okay. I
And
see
then
what
you
do.
click it again.
Do it again.
And then you pull it back. Oh,
Try it again.
yeah, plug. There you go.
Okay. There's another little loop there.
And now you pull it all the way out.
Okay, so this is being all done
Yep.
orthoscopically, right?
Yeah, and then all you do is pull this string. This little string right
Show
here.
here and just taking up the slack.
Yep, and you just pull it until it takes up the slack, and it self-locks.
Wow.
So
I
you-
need that for my shirts. Okay, but that's how it works, and you're really tying it together, basically.
Yep, and if you imagine if you had a peripheral tear, this has just locked it in.
So it keeps it
Keeps
stable.
it in place
Yep.
so you can keep
Wow.
your meniscus.
You are now an orthopedic surgeon.
Wow.
See that?
At least baby
Brilliant.
steps
See
towards it.
that?
That's pretty amazing.
But you really can, again, stabilize this and give it the ability to repair itself.
That's correct.
Okay, that's all you're trying to do.
That's all we're trying to do.
That's all you're
Now,
trying
we give
to
it
do.
the best chance possible.
Right. Well, amazing stuff nowadays, isn't there?
It's incredible what can happen these days.
But if anybody is experiencing pain like this and they need someone to take a look at it, obviously DMOS is the place to go.
Perfect.
Okay, and where is your office at?
Mine is over by Lutheran Hospital at the Penn Medical Plaza.
All right, so if they want to get a hold of you, just get a hold of DMOS here. We can pull the screen up here. We'll show you how to get a hold of them. These are the best people in the business to repair anything like this. You saw the various ways they do it, the various stages of meniscus injuries and what they can and can't do. So again, get rid of the pain and get back to living life.
That's correct.
I was going to say, remind us the symptoms. Obviously, if you had like the wrestler who can't bend his knee, that's pretty obvious. But some other things to look
Pain,
out for.
tenderness, snapping sensations, catching sensations, and especially if it's locking on you. That's
Okay.
important to know.
Give the experts a call.
Yep.
Wonderful.
Thank you so
Dr.
much.
Lynn, for joining us
Amazing
today.
stuff. You
Nice to
guys are
see you.
incredible. Thank you so much for coming in. We
Thanks for
really
having us.
appreciate
We
it.
Do we
really
have to call him
appreciate it.
doctor now? Not yet.
Dr. Lou.
Not yet?
Perfect.
Okay, a little bit more training.
It's 20 minutes.